It's a big problem on the part of the government that starts off our broadcast, specifically this new health care law. Beyond the colossal problems with the website Well Chronicled, now it's the assurances by the president that are drawing scrutiny when he told Americans if you liked your health care plan, you could keep it. Well, with insurance companies discontinuing some policies of some people, we are finding that's no longer the case, as many deal with the potential for new higher costs. Our senior investigative correspondent Lisa Myers broke this story last night and has more for us tonight from Washington. Lisa, good evening.
Brian, good evening. So far, almost 2 million of the 14 million Americans who buy individual coverage have gotten letters that their policy is canceled or has to change because of the law. Still, the White House insists the president did not mislead Americans when he promised everyone could keep their insurance.
Here's a guarantee that I've made. If you have insurance that you like, then you will be able to keep that insurance.
That doesn't sit well with George Schwab, who's retired, started a new business, and been told because of the new health care law, his current policy is no longer available because it doesn't meet minimum standards. His new policy comes with a premium increase of more than 400%.
I just wish I could have my insurance back. That's what I want.
He now has to pay for more than he wants, including maternity coverage for his 59-year-old wife.
I just don't think this was all that well thought out. And, I think the intentions were good, but, there's a lot of things that need to be fixed.
My constituents are frightened.
On Capitol Hill, the first administration official to appear since the botched rollout of the Obamacare website apologized, but insisted to a somewhat incredulous audience that the system is now working.
The system right now is working?
I'm saying it's working. It's just not working at the speed that we want and at the success rate that we want.
How do you not know how many people have enrolled?
Chairman Camp, we will have those numbers available in mid-November.
The president's spokesman emphasized that those losing their coverage are getting better plans and sometimes subsidies. He seemed to rephrase the president's promise.
If you had insurance that you liked on the individual market and you wanted to keep that insurance through 2010, 11, 12, 13, and in perpetuity, if you wanted it and it was available, you could.
A reminder that 80% of Americans are not impacted by this because they get their insurance through their employer, Medicare, or Medicaid. Now, HHS Secretary Kathleen Sebelius is on the Hill for the first time tomorrow since the rollout and will face tough questions. Brian?
Lisa Myers starting us off from our D.C. newsroom tonight. Lisa, thanks.